Uh, Hi everyone. Welcome back to today's session organized by VODAN Africa and Asia. My name is Putu Hadi, and our agenda today, I will copy the agenda in the chat box so you can see the agenda to see the today's agenda. And as always, try to keep our mic muted during presentation to prevent background noises. And if you have any question, you can raise your hand virtually, and then or you can type them into the chat box. So I will now hand over to Professor Francisca here. If it's not, I will start the update from the health facilities communication. So I will share my screen right now. Oh, Professor Francisca is here. So I think Professor Francisca will open.
Putu, she's sick, so I think she is not able to speak a lot. So maybe you can proceed. Yeah.
Okay. Okay. Okay, then I will lead the session. So I will start from update of health facilities communication based on yesterday's discussion on access and control meeting. I will share my screen. So this is the result of yesterday's discussion. So I will start from Nigeria. From Nigeria, the progress is like I cannot find Ibrahim Badamasi Babangida Specialist Hospital Mina, the file of this health facility. So I'm still waiting from Abdullahi to get the file, and Abdullahi still need to check the answer from health facilities. So right now he will check the answer from the health facilities, and we are expecting the clarification from him this week. And from Uganda, the progress, Mariam finished interview with Lira Hospital, but still communication with Hoima Hospital still in progress. Unfortunately, Lianto the hospital didn't respond Mariam. So let's see what is the next progress for this for Hoima and also Lianto the hospital. But we're finished with a case clinic report. And from Kenya, William still waiting response from Zambezi and Beacon Hospital. And Dr. Reginald scheduled a meeting for VODAN introduction to Nairobi City County Ministry of Health on Thursday. And Alia, Mariam, and I will be there. And I already finished the introduction PPT. So we will have a discussion on Wednesday to discuss about the introduction part, which part of introduction will be introduced to them. I mean, like who speak for what on Wednesday. And from Ethiopia, we're finished with all of the interview question lists, and we are finished with the report for Gelan Health Center. And from Somalia, basically we are finished with all of the hospital result, communication topic list result, and we have two report for public and private health facilities. And from Zimbabwe, yesterday Professor Bernard was attend the meeting, but he explained that the permission still delay due to trust issue and skeptical issue there. therefore need a legal consultation and assistance. So right now they are still in progress to get the permission from that consultation. And from Tanzania, I'm finished with the transcription and will be report the result. And this is the dashboard and facility report, and I'm very happy because it is fruitful discussion yesterday, because I know now that there are various information flow. I mean, like, it is not same between health facilities to the other health facilities. This is from a case clinic, for example, and this is public health facilities from Somalia, and this is from Kenya Medical Research. It is different information flow. And also I put the who can access what in the information flow report. And this is from the from Gelan Health Center. So it is a good discussion every Monday, because we are discussing about the GDPR rule and also this information flow. And each country coordinator are really helpful to give me some input about what is the condition of the information flow in health facilities. So that's really a good input from each coordinator about this. And that's all. So I will stop sharing. That's all for now. And if you have, I'm not starting with the with Nigeria. I will start the to create the identification of information flow and also GDPR rule for Nigeria this week. So that's all for now. Do you have any question or comment on this? Well, if there's no question about my report, so I will move to report from Alia about templates and vocabularies. So the floor is yours, Alia.
Hi, everyone. So basically, if I speak regarding the vocabularies, we are still reviewing. Let me share the screen so everyone can see it. So we are still in the process of reviewing vocabularies after John's comments. Basically, we have divided for each country coordinator the vocabularies to work on. So, for instance, this general list and health facilities are being reviewed by me, whereas Uganda disease is being reviewed by Mariam. Ethiopian diseases and Ethiopian ANC vocabulary sheets are being reviewed by Augice. And vocabularies by Tunisia, which is led by Dr. Mariam, already has been reviewed, and she already sent it back to John. And also there is the vocabulary sheet, which is being created by Kenya before John's review, and it wasn't reviewed by John. But I would like to ask Putu and also William maybe to have a look, and since we already were given by an advanced training, so have a look each section of this review. So for instance, description, and I see that I already seen that there is no version of the vocabulary, and like this kind of information needs to be reviewed, so by Putu and William. Otherwise, that's it from my side. The templates are also have been finalized, and Putu submitted his template from OPD Kenya. So, and now it's being reviewed and it's actually in good shape, but there are some still things that need to be discussed with Kenyan team, so I'll address it after this call. So we are still waiting. If I speak regarding the Nigeria, so Dr. Sakinat is creating a new OPD for Nigeria. So because it's the one mostly welcomed by MOH, and also use it in most health facilities. So that's why she's creating a new one. So that's basically it from my side. I don't have any more issues or things to add. Thank you, Putu.
Thanks, Alia, for your update. And I'm sorry, Alia, because I will check the vocabulary this week, because last week we are focusing on the feedback for the template, the feedback from John for the Kenya template.
Yeah, sure.
Yeah.
Thank you, Putu.
And next agenda is about CEDAR deployment. So all of us, you can go ahead.
Thank you, Putu. Yes, regarding the CEDAR deployment, we are in the process of running this service. Like, we have 2 person, like recently also for Nambobi ran it almost all service, only 2 were left. Then we will run, after they're running all the services, we're going to make query for those CEDAR point. This one is first point. Then second that root one actually need to submit technical instructions regarding the CEDAR deployment, but because of his father in hospital, and he's not responding to my messages, and I think after he's free, I will try to reach him. That's the point. And the last one, I also ordered one personal computer for CEDAR deployment purpose. I believe at the end of this week, I will be able to also run it in my locally machine, because previously it was not able to run all of them due to limitations of the machine. That's all from my side.
Thanks, Olzas, for your update. Is there any question or comment? So Olzas, I just want to know, so Rudwan work now for the data pipeline, right? For the data pipeline architecture, is it?
I'm not sure about data architecture part.
It's working around the data repository, and also how to connect it to CEDAR, and also how to transform it and loading to the dashboard front end.
Yeah, I think so. Rudwan. Yeah. Sorry.
Right. I just want to make sure that that is.
I think Rudwan was telling something regarding this dashboard. I think Alia knows more than me. Because
okay.
Basically, Rudwan is also assisting technical team on the CEDAR deployment, and also running queries, because his thesis is focused on that aspect. And then he is also contributing to dashboard, specifically on the back end stuff. So that's it.
Okay. Thanks, Alia, for your explanation. And then we're moving to the next agenda. It's update of the country coordinators meeting, and also country updates. Well, let's start from Dinjamo. Dinjamo is not here, so Dr. Reginald.
Yeah, thank you, Putu.
Yeah.
From the country coordinators, we haven't had a meeting as such, but we follow everything that happens within VODAN, the training, the workshop. So we are very pleased with the teams that are doing everything possible to make sure that we succeed in our project. We also thank our coordinators, Professor Francisca, Professor Miriam, for the updates from World Health Organization conference that we had last week. And today we had the University of Geneva educating us on the key questions that we are discussing in VODAN are similar throughout. Then from the Kenya side, what I would say is that on Thursday we have a meeting, as you put it, and I think to be a very successful meeting. I've also seen that similar questions are being asked by Nairobi Metropolitan Ministry of Health team. So we are going to start having a good engagement just to see where we go. So the introduction is on Thursday, and then we continue from there. Then lastly, I think as we are moving towards developing vocabulary templates, I would suggest now that NMS are on board, that Kevin and Alice from the Ministry of Health can work with William so that we come up with a clear stand on Kenya, the Kenya templates and the vocabulary. So that's all, Putu. Thank you.
Yeah, thanks for the update, Dr. Reginald. And it is really good when the Nairobi, there is like health facilities involved in the meeting, because to be honest, when I edit the template from Kenya, I mean, like I checked the OPD and I'm not sure what is this about. So because we need to describe and put helping text there, so it is good if the health facilities involved here.
Yeah, the Kelvin is on board here, so we'll hear from him on Thursday. Sure.
Okay.
Thank you.
Thanks, Dr. Reginald. And let's move to Dr. Mariam Gardalu for the update. So the floor is yours, Dr. Mariam.
Thank you, Putu. Hello, everyone. So regarding vocabularies, we try to respect all John comments, and we sent the new version of the Excel sheet of vocabularies to John for a second review if it's possible. And we also made some adjustment concerning the templates according to the new version of the vocabularies. We tried also the CEDAR installation, the virtual machine, but we have some issues. So we will share the screenshot about these problems in the group. Found a solution if it is. That's all from our side. Thank you.
Okay, thanks, Dr. Mariam. So let's move then to is Dr. Saki not here? So well, I think Efron, can you update about Ethiopia? Do you know about the update from Ethiopia, Efron? Because Dr. Wondimu is not here.
Hello.
Yeah, you can go ahead.
Okay. In the communication side, as you presented, all health facilities are communicated and ready for the next step. And in the technical team, Augustine and Tegist are assigned to conduct their assignment, and they are ready. Tegist and Augustine discussed finalize, especially Augustine's assignment integrately. These are updates. Thank you.
Okay, thanks, Efron, for your update. Well, Professor Bernard is not here, and who can represent Nigeria? So also not here. Okay, then I think we're done with the update of the country coordinators agenda. But before we move to the next agenda, Kelvin is here, so I think it is really good to introduce yourself, Kelvin. And welcome to VODAN. You can introduce yourself, Kelvin.
Hello, this is Kevin from NMS Head ICT.
Yeah, thanks, Kelvin. Welcome to our group. I will contact you after this meeting because we need help from you to create a vocabulary and also template from if it's necessary. So we will discuss it later, Kelvin. Thanks for
No
joining
problem.
us.
No problem. You're welcome.
And let's move to the next agenda. But I think Misha is not here to update special issue. And then is there any question then or any other business that want to share here? Maybe Mariam, do you want to share something? Do you want to share
No,
something?
nothing at the
Okay.
moment. Yeah, nothing at the moment.
Well, Dr. Ibrahim just joining the session. Maybe I will ask Dr. Ibrahim about the upgrade of the communication from the health facilities. Hi, Dr. Ibrahim. Dr. Ibrahim, can you hear me? Dr. Ibrahim? Dr. Ibrahim? Can you update about the communication from Nigeria? Update about the health facilities communication, Dr. Ibrahim. Dr. Ibrahim? Okay, I think there is a network problem in network.
Hello, Putu. Are you calling Nigeria?
Yes.
Okay,
Because
so Putu, good afternoon from Nigeria, and how are you all? Sorry, I joined late.
Yes.
Yeah, what's the question so that I can? Sorry, I was in another physical meeting with the team.
Yeah, I'm asking about the country update of the country coordinators meeting, and if you have any update about the health facilities communication or permission from Ministry of Health or etc.
Okay, at the moment, it's just goodwill message from Nigeria as usual, except that health facilities have been on our questions to say when are we coming for deployment, but we told them to exercise little patience that even at the whole team, we're still working on getting the things and the specifications so that we know what kind of machines and facilities are we going to be deploying. So at this moment, this is what we have. Then administratively, I come with the goodwill of the Federal Ministry of Health. They are extending their greetings to all members of VODAN because we have also mixed up with them again to tell them what we have been doing. So this is what we have from Nigeria. And I think Mala Abdullahi Kau, Mr. Abdullahi Kau will also get back to you, Putu, on the record of Kacha that you say you didn't see. He has actually fine-tuned that, and I think he has communicated. Thank you.
Yeah, thanks, Dr. Ibrahim, for your update. So then, if there is no questions anymore, I will close this meeting. So thanks everyone. As always, the video recording of the webinar will be available this week in every channels in such as Slack and WhatsApp and YouTube channel. And thanks again for joining us. And we'll see you next week on VODAN Africa and Asia meeting. Goodbye, everyone.
Bye. I join later.
Bye.
Yeah.